and welcome. 2 days ago I went out and wanted to buy a face mask. The Kafunshu season starts, or hay fever season starts here in Japan, and my husband has strong hay fever. However, we have also the coronavirus going on in China, and it is now around the world. And I keep this also in mind. As I mentioned in my last video, I'm wearing also the mask when I go to the clinic or whatever. So there are many opinions about it. The main thing is actually with the mask. If you're sick, other people most probably don't get sick if you're wearing it. Yeah, so anyhow, I went out because we were running low on masks. And I thought it's important that my husband has a mask. He is using the train every day, 1 hour to Tokyo. So the supply of surgical masks here in where I live, in Miura Peninsula or Yokosuka, they're running very low in stores. And this is amid the fears of the coronavirus. So now, I think last week it emerged already on some of the Facebook chat rooms that some people bought whole lots of masks. It was not limited at that time at pharmacies, and they're making money out of it. You can see on various websites how expensive it is. And last night there was also a news report.
2,800 yen, that's about 15 times the usual price. Cases of price gouging have been reported, but the authorities say it's difficult to regulate such sales by law. At this cram school in Tokyo, the administrators are eager to prevent students studying for university entrance exams from catching cold, flu, or pneumonia. This instructor says if a student forgets to wear a mask in class, he hands him or her one to make sure they are all protected. Starting this month, they made it mandatory for all instructors and students to wear masks in class. This student says the coronavirus outbreak must be making all examinees anxious. He says he will cooperate with the school's policy to prevent infection.
But surgical masks are in short supply. Shelves at drugstores in Tokyo are empty. The store put masks on sale this morning for the first time in 2 days. But all 50 boxes sold out in just 15 minutes. Store manager here says he limited the sale to 1 box per family because he wants the mask to reach those in real need. He says, however, the 50 boxes sold out in no time. The shortage led to price gouging of masks at online shopping sites. This box contains 50 masks. 5 boxes sold for 47,000 yen. Boxes of masks were sold via flea market apps for several thousand to several tens of thousands of yen. This 50 box set was on sale for 200,000 yen. In some cases, buyers were willing to pay 10 times the usual price.
And they even interviewed one person who admitted that he makes money out of it. I thought, this is very amazing.
We talked to some of the sellers. A man from Western Japan listed some masks that had been lying in his closet for more than 10 years. The man says the masks sold for about 10 times the price he paid for them. Says he was surprised that they sold at the asking price. He says he feels a bit sorry for people who need masks but cannot get them. This man from Fukuoka says he bought masks in his neighbourhood late last month and sold them for more than 3 times the usual price. He says he was lucky to have been able to make some money. He says the price naturally rises when demand exceeds supplies. He says he did nothing wrong.
Well, anyhow, people asked to control this, so to put some control of it and lower the price. But this is not how the system works, at least not here in Japan. And in the moment it's allowed. But in some pharmacies, they're starting to limit how many packages you can buy. So for example, 1 person 3 packages or something. But I haven't experienced this because I went to, we have Matsumoto close by and Hak, and I couldn't find any face mask. And I will go out today again. This is basically the day where I put this video up on YouTube and check again if I can get a face mask. So what happened is I texted some of my friends and they said, oh yeah, they still have it in their stores around the area, for example, Yokohama. Whereby other people on Facebook in the chat room said, no, all stores are wiped out of face masks. Additionally, fever medicine and disinfection
are in high demand.
So in one of these news reports, one newspaper which I love to read is the Mainichi, the English Mainichi. And they said that manufacturers are at full throttle to produce enough surgical masks to meet the snowballing demands. But many consumers have been unable to find them in drugstores or convenience stores that normally offer a variety of the products ahead of the Japan hay fever season. Oh. So my husband takes medicine and everything, but it is still with him very, very bad, and hay fever is a real thing here in Japan. I think every 2nd person has hay fever here. Yeah, and then comes the coronavirus, which is spreading from China. I think on the 23rd of January they locked down the city. I cannot pronounce Wuhan correctly.
Wuhan.
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 Wuhan. Anyhow, it's on lockdown. Today is the 6th of February, so 14 days. They say the incubation time is 12 days or something like this, 10 to 12 days or 14 days. So people are now everywhere in the world under quarantine, and it's a big headline all around the world. Basically every hour a new thing is coming up. One big thing is I'm in German chat rooms, English chat rooms and Japanese chat rooms, and even some Chinese one. And what I feel is, like, especially in Germany, everybody said, oh, social media is spreading false news. Well, social media actually draw attention to this problem in Wuhan. And there was a chat room of, I don't know, a few doctors, 6 or 7 doctors, which actually tested 7 patients for SARS positively. Then it was the novel coronavirus. So on Twitter, when news are breaking, most of the time you find out first on Twitter. And basically on the 23rd or 24th, I can't really remember, there was this doctor speaking Chinese and telling that so and so many people were infected. And these are the real news, and it's not true what the newspaper are saying about it.
Of today, there are 564 deaths and 28,060 confirmed cases and 3,859 severe cases.
Dr. Michael Ryan said in the video from the WHO on the 29th of January at minute 3:40, I show you the video here.
Many people are experiencing a minor form of illness, but still 20% of reported cases are reported as severe, and 2% of confirmed cases are reported to have died.
So people are worried. We plan to go to the Kamakura festival in the north of Japan. But when we heard end of January that, well, there were 2 factors why we cancelled our vacation. One was not enough snow, and second one is the coronavirus. We don't know if it's serious or not, and you usually don't see governments building brand new hospitals in 10 days. So yeah. In 2003 I went through SARS with my sons at that time, 3 and 5 years old. And what happened in Singapore, I think 3 ladies went for a shopping spree to Hong Kong.
And when they came back, one of them had SARS. This was patient number 1 on March 1st. And then on March 12th, the WHO issued a global alert on outbreaks of severe form of atypical pneumonia in Hong Kong, Vietnam and Guangdong. So on March 15, the term SARS is coined. Singapore has 16 cases, and the Ministry of Health, MOH, forms the SARS task force. On May 16, MOH is issuing hospital guidance to screen emergency department patient for fever and travel history to SARS-affected areas. It issues infection control guidelines. On March 22nd, TTSH Tan Tock Seng Hospital is designated the SARS hospital. The SARS hotline is set up. The number of cases rises to 44. On March 24, the Infectious Disease Act is invoked. About 740 people are home quarantined for 10 days. On March 25th, Singapore experienced its first SARS death, patient number 1's father. March 26th, a pastor who visited patient number 1 becomes the second person to die of SARS. On March 27, all schools are shut until April 16. Those who die of SARS must be cremated within 24 hours. March 29, temperature checks are introduced for all passengers entering Singapore through Changi Airport. April 5th, Singapore General Hospital SGH is hit by a SARS outbreak. The closure of schools is extended. April 6th, a ministerial committee is formed. April 7, TTSH Dr. Ong Hock Soo becomes the first hospital worker to die from SARS. Patient number 1's mother also dies. Schools reopen on April 9 to 16th. April 22nd. SARS kills SGH, vascular surgeon Alexandre Chao. Nurse Hamida Ismail, one of the first nurses warded for SARS, dies on Mother's Day. This is on May 11. May 18. Last SARS patient detected. May 30. WHO declares Singapore SARS-free. July 16. SARS eradicated in Singapore.
I left my kids at home and we stayed basically at home. I was not very worried about it. I just thought, better don't go where everybody will get it. And at that time we already knew half a year before that Chinese are coming to Singapore and buying medication in bulks. And there were rumors of an unknown disease. In my circle of friends we were talking about it. So therefore, with this coronavirus, I thought, this time they say it immediately and that's okay. So I assume they will get it under control. However, at the same time, this video about building a new hospital was a little bit worrying. And there are many rumors out there where this virus is coming from. I have the feeling people try too hard, don't say something and people go into panic mode. I think that's not the case. I think people just want to know. Panic is a reaction of something. If I watch TV and they say, you better stay at home as much as you can, you will do it. Now on this cruise ship here in Japan, there are 10 patients sick and another 10. So that's a problem. Better be careful than sorry. Still go out, I still go shopping. I avoid touristy places. Yeah, another thing, the colleague from my husband, he's Chinese, he's not allowed to fly to Taiwan. This is where I cannot follow the whole thing. It's everybody can get it. And it's now all around the world already, so it's not only Chinese. Everybody can get it. I think on this cruise ship there are 1 or 2 Japanese who are infected with the novel coronavirus. I feel very safe here in Japan, but I want to buy face masks as well because I'm this type of person who wants to wear a face mask. I know there are other people who don't want to wear a face mask, up to them. For me it's like, I wear a face mask. We have done it in SARS. Also at that time everybody was like, it doesn't help, Martina, why are you doing it? For me it was something like a reminder, you know, you put it on and this reminds me on be more careful with where you put your hands and wash your hands more regularly. Yes, I wash, especially here in Japan, you have always a wet cloth beside you when you have lunch and you will clean your hands first. But still, you know, it's you wash your hands before lunch, but there are times where you might forget washing your hands and touching your mouth or your eyes or your nose. With the kids, I just said put the face mask on and think about it, wash your hands all the time. And it worked. It was like a uniform, putting a uniform on and get reminded with this. And therefore I thought, I'm thinking a mask wearing is not the worst thing on earth. So, and then another thing is, during SARS, there were always these banners up hanging from bridges or buildings in Singapore, praising nurses and doctors. And I thought this is such a sweet thing to do. I loved that actually. Oh well, it is what it is. I just thought I'd give you a little update about what's going on here in Japan with the coronavirus. So the first coronavirus here in Japan was a Japanese returning from Wuhan. And now we have the cruise ship. There are over 170 passengers and some crew members infected, plus 1 Japanese quarantine officer. So yesterday evening NHK had a news report, and in this news report they talked in detail about this. I recorded it and I will show you this now.
The virus from entering the country has now become one of the patients. Professor Mitchell Cutler talked to Medical Advantage Central University. It says the evidence shows the risk of infections on the cruise ship has now become extremely high.
Health officials say another 39 people on the quarantined Diamond Princess cruise liner tested positive today for the new coronavirus. A quarantine officer who was on the ship early last week has also been found to have the virus. The infection of the quarantined officer raises questions about the adequacy of the authorities' protective measures. The Diamond Princess remains under quarantine at Yokohama. This evening, refuse was removed from the ship. There are still about 3,600 people on board. Health officials say another 29 passengers and 10 crew members tested positive today for the new coronavirus. And they revealed that a quarantine officer in his 50s who was on the ship early last week was also found to have the virus. In 2015, Dr. Yasutaka Mizuno was involved in quarantine measures against the Middle East respiratory syndrome-related coronavirus. Mizuno says the quarantine officers who came on board the ship would have been working under very demanding conditions. In this case, it was probably one little mistake that caused the officer to become infected. The quarantine officer, who was tested positive for the new coronavirus, had been on the Diamond Princess last Monday and Tuesday. He had helped gather questionnaires from passengers and take their temperatures. It is reported that he had also sometimes entered passengers' cabins. Between last Wednesday and Friday, he had been at his usual workplace. He developed a fever on Sunday and was tested for the virus the following day. The officer had been wearing a surgical mask and gloves, but no protective suit or goggles. The Health Ministry says this was in accordance with guidelines from the World Health Organization. Dr. Mizuno describes the type of precautions that are taken depending on the situation. When there is the risk of infection, quarantine officers are expected to wear goggles, surgical masks, gloves, and other protective gear. Dr. Mizuno says when quarantine officers are examining people, there is the risk of them being exposed to coughs and people trying to clear their throats. Goggles can protect the wearer from the spray that comes from an infected person's mouth. Mizuno says, in his opinion, quarantine officers in such cases should be protecting their eyes and other surfaces of their body from any spray coming from the people they are examining. Mizuno says due care should be taken afterwards when it comes to removing gloves. Mizuno says the outside surface of the gloves should on no account come into contact with any exposed surface of the body when the gloves are being removed and put in the bin. If that happens, the person has come into contact with a tainted surface and risks picking up an infection. Mizuno says he has experience of removing gloves in the proper manner, but it's not at all easy. Mizuno says the quarantine officer would have had a lot of complicated tasks to perform, which would have increased the risk of him picking up the virus. Mizuno says quarantine officers usually don't process such a large number of people who have arrived on a ship or plane in a short space of time. Small mistakes can occur, and then they do. It can mean an officer ends up getting infected as well.
The Diamond Princess sailed back to Yokohama port shortly before 9 a.m. today to furnish fresh water supplies after spending time out at sea. The number of confirmed cases of infection with the coronavirus on board the ship has now risen to 174. People have been taken off the ship as of yesterday for hospitalization after testing positive. 4 reportedly have severe symptoms. 2 of them have been in intensive care. Today, some passengers wearing face masks were seen waving to people who came to the port. We talked by phone to some of the passengers who have been confined to their cabins for 10 days now.
What?
Yoshio Komura, who's 74, says his wife had a fever last night. He says it could have been a common cold, or it could have been the coronavirus. He says he called the medical office on the ship, but nobody called back. He says he can't go out to ask for help. And the situation is hopeless. Another passenger, 72-year-old Yoshi Koyanagi, told us that his regular medication has finally arrived. Koyanagi says that he's getting sleepier day by day. It may be a sign that he's getting weaker. He says he wonders how much longer he can survive all this. He wants to be tested for the virus as soon as possible. He says he just can't wait to get off the ship. Yesterday, a team of infectious disease specialists visited the ship to see if adequate measures are being taken to prevent the spread of the virus. One of the members of the team, they believe the tiniest mistakes made or the smallest vulnerabilities in the system of the ship might have led to a series of infections.
This person says that once the sneezing gets on people's hands, and then if you use those hands to touch eyes or other mucous areas, then it could spread infection.
The 206 nationals who evacuated from Wuhan, the government chartered plane on January 29th. He says it's been like riding an emotional roller coaster over the past 2 weeks. "197 of those people tested negative for the coronavirus just after arriving back in Japan. Since then, they've been asked to stay at a hotel in Chiba as a precaution. Yesterday, they were tested for the virus again." The test results came back today, and they're all negative. The person says the negative test results finally lifted a weight off his mind. He says he kept wondering if in fact he had the virus. It might have infected some other people. He was prepared for the worst. He has a tremendous sense of relief. That's all he can say now. He says he's grateful for all the heartfelt messages of support. This woman says she's received from many people during the past 2 weeks. She'll never forget the kindness the rest of her life. The government says all 197 can now go home as soon as they're ready.
It is good that the people got to go home, and it is a relief.
So I hope you liked this video. This was a very depressing topic for me. I see you next Thursday. Bye.